Details about the burial preparations. Let's now get into health matters. The doctors' strike in Kenya continues 3 weeks after it began, leaving public hospitals struggling. It has been a painful Christmas for Kenyans seeking medical services, as most had to either seek services at private clinics or to be treated by the nurses, who are mostly handling only minor medical conditions. Let's now join our reporter Timothy Otieno, who's going to give us a status report of how exactly the health situation is here in Nairobi. Good afternoon, team. You have been doing spot checks in a number of hospitals. What can you report?
Well, of course, Akisa, basically operations are still very slow in most of the hospitals that we managed to visit. Of course, this is understandably so because of it's the festive season, so many people are going to hospitals. Right where I'm standing is outside the Mbagathi Hospital. Of course, we were previously denied access into the institution, but we were able somehow to get inside and just to get and see how operations are ongoing. But of course, we can report that indeed nurses are on duty, but they don't have as much work. Very few patients are streaming into these hospitals. We were able to spot about I was able to spot about 4 nurses here at the Mbagathi Hospital on the outpatient section. But of course, they were serving just about, it was one, I could say one customer or one patient had come to visit at the time. So very slow operations. And aside from the Mbagathi Hospital where we are right now, earlier on we were at the Dagoretti Sub-County Hospital. And the situation is pretty much the same. Very slow operations ongoing, very few patients visiting the areas. The medical services in that particular hospital. In that particular hospital, there are 6 nurses who were on duty, and they told us from the 24th and today they were able to see about 5 maternity patients. 2 of them delivered at that facility, but they had to refer 3 others because their pregnancies had some complications that they could not handle. But that is the case that has replicated itself over the last couple of weeks. Nurses have been turning away patients with complications that they cannot be able to handle because the doctors have insisted that they're not going to go back to work until that 300% pay increase in their salaries has been adhered to by the government. So as it stands, operations really slow. The nurses are on duty, but they're not, of course, helping out, and they're not listening to or receiving patients as expected, perhaps because of the festive season. Very few numbers of patients that we were able to see this morning, both at the Dagoretti Sub-County Hospital and here at the Mbagathi Hospital, Akisa.
So what are some of the alternatives that patients currently have?
Well, basically, I think, Akisa, most now have to contend with either going to private facilities for those dire cases. But remember, private hospitals in themselves have somewhat been joining in this doctors' strike. Every Thursday, the doctors who are serving at private facilities have agreed to join their colleagues in solidarity with the strike. So private hospitals can only attend to those critical injuries and those dire cases, except on Thursdays when they join their colleagues in the nationwide strike. So as it stands, the reprieve for most patients has to be private hospitals, but you have to remember that not everybody can afford to get medical services from these facilities. So most Kenyans are left to suffer and seek alternative means to try and get the much needed medical assistance that they do. But of course, the private hospitals are standing in, but only to the extent of someone's pockets, and only up to a point where on Thursdays no medical services are being offered at private facilities until this doctor's strike comes to an end. So as it stands, it's the Kenyans who need these medical services that are going to be suffering. Of course, right now we're seeing a low number because of the festive season, but as we move into the next year, next week, perhaps these numbers may go up as more come back into the country. And of course, many are really waiting to see how this is going to be sorted out. It's the 22nd day that the doctors are on strike, and no headway seems to be coming from either side of the negotiating team. That is the Ministry of Health, the Ministry of Labor that was an arbitrator, and the doctors' unions so far, Akisa.
Timothy, thank you very much for that. That's our reporter, Timothy Otieno, just giving us updates on the dire health situation that currently is in the county of Nairobi, is one of them, even as the doctors' strike and